For thousands of years, we thought we knew what ancient medicine looked like. Crude remedies, superstitious rituals, primitive guesswork wrapped in mythology. We assumed that modern science had long surpassed anything the ancients could have possibly understood about the human body. But when artificial intelligence was finally given access to untranslated Egyptian medical papyri, texts that had been sitting in museum archives for over a century, it uncovered something that shouldn't exist. Surgical techniques we only rediscovered in the 1900s. Pharmaceutical compounds we're still trying to replicate. And diagnostic methods so precise, so advanced, that modern doctors are now questioning whether we've been moving forward at all, or simply catching up. What the AI found wasn't just impressive, it was impossible. Knowledge that predates our entire understanding of anatomy, chemistry, and disease. Procedures described in hieratic script that match cutting-edge medical science with terrifying accuracy. And the deeper the AI dug, the stranger it became. Because buried within these ancient texts were treatments for conditions we didn't even have names for until the 21st century. Experts are now asking a question no one wanted to face. What if the ancient Egyptians weren't primitive? What if they knew something we forgot? And what if we've been ignoring the answers for thousands of years? But before we dive into this mind-bending discovery, make sure to subscribe and turn on notifications, because what you're about to learn could rewrite the history of medicine forever. The scrolls that time forgot, Egyptian medical papyri, aren't exactly unknown. Archaeologists have been finding them for more than a century. The Edwin Smith Papyrus, the Ebers Papyrus, the Kahun Gynecological Papyrus, each one a window into how the ancient Egyptians treated illness, injury, and disease. For decades, scholars translated what they could. They marveled at the organization, the systematic approach, the surprising sophistication, but there was always a problem. Large portions of these texts remained untranslated. Not because they were damaged, though some were, but because the language was too complex, too technical, too layered with meaning that didn't fit into neat modern categories. The Edwin Smith Papyrus alone contains 48 cases of traumas and surgery, described with clinical precision. It discusses fractures, dislocations, tumors, and wounds, listing symptoms, diagnoses, and treatments in a format that looks almost like a modern medical textbook. Written around 1600 BCE, but likely copied from sources even older, it's considered one of the oldest surgical documents in existence. And yet, even after a century of study, Egyptologists admitted they had only scratched the surface. There were terms they couldn't translate, procedures they couldn't fully understand, references to tools and techniques that seemed out of place for the Bronze Age. Then there's the Ebers Papyrus, a massive 110-page scroll covering over 700 remedies and magical formulas. It talks about the heart as the center of a network of vessels, a concept that predates William Harvey's discovery of blood circulation by over 3,000 years. It describes diabetes, depression, cancer, and asthma, using language that shouldn't exist in a world without microscopes or laboratories. For years, scholars assumed much of it was metaphorical, symbolic, religious. They believed the Egyptians were mixing real medicine with superstition, unable to separate science from magic. But what if that assumption was wrong? What if the reason we couldn't fully translate these texts wasn't because the Egyptians lacked knowledge, but because we lacked the framework to understand what they were actually saying? That's where artificial intelligence entered the picture, and everything changed. When the machine started reading. In 2023, a team of computational linguists and Egyptologists decided to try something radical. They fed high-resolution scans of untranslated Egyptian medical texts into a custom-built AI language model. One trained not just on ancient languages, but on modern medical terminology, pharmacology, and surgical techniques. The idea was simple: Let the AI find patterns that human translators might have missed. Let it cross-reference ancient descriptions with modern medical knowledge and see if anything lined up. No one expected what happened next. The AI didn't just translate the texts. It recognized them. It identified surgical procedures by their descriptions, matched ancient remedies to modern chemical compounds, and flagged diagnostic techniques that corresponded almost perfectly to contemporary medical practice. In some cases, the AI's translations were so precise that doctors reviewing the results assumed they were reading from a modern medical journal, not a 3,500-year-old papyrus. One of the first breakthroughs came from a section of the Edwin Papyrus that had long baffled scholars. It described a procedure involving the skull, the meninges, and something the Egyptians called the pulsating brain. Traditional translations were vague, assuming it was some kind of mystical reference. But the AI recognized it immediately. It was describing trepanation, the surgical drilling of holes into the skull to relieve pressure, a procedure modern medicine didn't widely adopt until the 19th century. But here's the unsettling part. The Egyptian description included details about infection control, post-operative care, and even the use of specific plant-based antiseptics that we now know have genuine antimicrobial properties. The AI didn't stop there. It began identifying compounds. One remedy, listed in the Ebers Papyrus for treating infections, called for a mixture of honey, willow bark, and moldy bread. For years, historians dismissed the moldy bread as superstition, but the AI flagged it immediately. Moldy bread contains penicillin. The Egyptians were using antibiotics 3,000 years before Alexander Fleming discovered them in 1928. Then came the truly shocking part. The AI found references to what appeared to be anesthesia, a combination of opium, mandrake, and henbane, described in precise dosages used to quiet the body during surgery. Modern chemists who analyzed the formula confirmed it would have produced a powerful sedative effect, comparable to early anesthetics used in the 1800s. The Egyptians weren't just performing surgery. They were doing it with pain management protocols that wouldn't be seen again for millennia. But that was only the beginning. Because what the AI uncovered next wasn't just advanced, it was impossible. Medicine that shouldn't exist. As the AI continued its work, it began pulling out information that didn't fit any known timeline of medical history. Descriptions of the circulatory system that matched modern anatomy textbooks. References to the lymphatic system, which wasn't officially discovered until the 17th century. Discussions of the nervous system, the endocrine system, even what appeared to be an understanding of autoimmune disorders. One passage, translated by the AI from a fragment of the Kahun Papyrus, described a condition affecting women that caused chronic pain, fatigue, and inflammation. The symptoms matched endometriosis almost exactly. The treatment, a plant-based compound that, when analyzed by modern pharmacologists, turned out to contain phytoestrogens, the same type of hormone-regulating substances used in contemporary treatments for the condition. In another text, the AI identified a recipe for treating cataracts. The procedure described a delicate surgical removal of the clouded lens using a bronze instrument, followed by the application of a copper-based solution to prevent infection. Cataract surgery wasn't successfully performed in the modern world until the 18th century. And yet here it was, detailed step by step in a document from ancient Thebes. Even more disturbing were the diagnostic techniques. The Egyptians described using pulse rates, skin color, eye clarity, and even urine analysis to diagnose internal diseases. One text instructed physicians to observe the color and smell of a patient's urine to detect what we now know as diabetes. Another described listening to the chest with the ear pressed against the skin, an early form of auscultation that wouldn't be formalized until the invention of the stethoscope in 1816. The AI also flagged something historians had long overlooked. The Egyptians had a concept of channels in the body, pathways through which life force or metu flowed. For years, this was dismissed as mysticism, part of their spiritual beliefs about the soul. But when the AI cross-referenced the descriptions of these channels with modern anatomy, it found something unsettling. The paths matched the cardiovascular system, the nervous system, and in some cases, even the lymphatic system. The Egyptians weren't talking about magic. They were mapping the body. And then the AI found something that stopped everyone in their tracks. The pattern no one saw. Coming buried deep within the Ebers papyrus, in a section that had been partially damaged and largely ignored, the AI detected a recurring formula, not a medical recipe, but a mathematical one, a pattern of ratios and measurements that appeared again and again across different treatments, different conditions, different sections of the text. At first, researchers thought it was a coincidence, maybe some kind of symbolic numerology. But when they analyzed it further, they realized what they were looking at. It was a dosage calculation system. The Egyptians had developed a method for adjusting medication based on body weight, age, and severity of illness. This wasn't trial and error. This was pharmacokinetics, the science of how drugs move through the body, a field that didn't formally exist until the 20th century. The AI went further. It reconstructed the formula and compared it to modern pharmaceutical dosing models. The results were almost identical. In some cases, the Egyptian calculations were more accurate than early 20th century methods. They had somehow figured out, without labs, without controlled trials, without peer-reviewed studies, how to dose medicine with a precision that modern science didn't achieve until the age of computers. One researcher, speaking off the record, described it this way: "It's not just that they knew things we didn't think they knew. It's that they knew them better than we did for most of human history." That's not supposed to be possible. And yet, there it was. Undeniable. Encoded in ink and papyrus, waiting for a machine to finally read it correctly. But the question everyone started asking was the one no one wanted to answer. How? Where did this knowledge come from? The discovery sent shockwaves through both the academic and medical communities. Some scholars argued it proved that ancient Egypt had access to knowledge systems we don't fully understand, perhaps inherited from even older civilizations. Others suggested the Egyptians were better observers than we gave them credit for, that through centuries of trial, error, and careful record-keeping, they had developed an empirical medical tradition that rivaled anything in the modern world until the 19th century. But there was another theory, quieter, more unsettling. What if the knowledge wasn't developed at all? What if it was preserved? Ancient Egyptian texts often refer to wisdom passed down from the gods, from the time of the ancestors, from ages long before the pyramids. Mainstream archaeology dismisses this as mythology. But what if it wasn't? What if the Egyptians were the inheritors of a medical tradition far older than we ever imagined? Some pointed to the mysterious House of Life, the Per Ankh, an institution in ancient Egypt where priests and physicians trained. Ancient sources describe it as a place of secret knowledge where the deepest mysteries of medicine, mathematics, and the natural world were taught. Very few records of what was actually taught there survive, but the medical papyri we do have may be fragments, echoes of a much larger body of knowledge that has since been lost. Then there's the uncomfortable possibility that the AI itself revealed that we've been interpreting ancient texts through a modern lens that blinds us to what they were actually saying. For centuries, scholars assumed that anything in ancient medicine that sounded magical or spiritual was superstition. But what if those terms were simply placeholders for concepts the Egyptians understood experientially, but didn't have the language to describe the way we do now? What if their channels of life force were accurate descriptions of biological systems they could observe but not explain in cellular terms? What if their use of incantations during surgery wasn't magic, but an early understanding of the psychological component of healing? What we now call the placebo effect or psychosomatic medicine. The AI didn't just translate words, it translated meaning. And the meaning it found suggests that ancient Egyptian medicine wasn't primitive at all. It was advanced, systematic, and in some ways more holistic than the hyper-specialized approach we use today. What this means for modern medicine. If the AI's translations are accurate, and every indication suggests they are, then we have to accept a deeply uncomfortable truth. Modern medicine didn't invent most of what it claims to have discovered. It rediscovered it. Anesthesia, antibiotics, surgical sterilization, diagnostic imaging through observation, even pharmaceutical dosing, all of it existed in some form thousands of years ago. This raises a question that no one in the medical community wants to ask out loud. What else did we forget? Some researchers are now going back through the untranslated sections of other ancient texts, from Mesopotamia, from India, from China, wondering if the same thing will happen. Wondering if artificial intelligence will unlock medical knowledge that's been sitting in plain sight for millennia, waiting for the right tool to decode it. Others are taking it a step further. They're looking at the remedies the Egyptians used. The plant-based compounds, the mineral treatments, the combinations of ingredients that seemed random but are now being validated by the AI's chemical analysis. Some of these formulas are being tested in modern labs. Early results are promising. In some cases, shockingly effective. There's talk of reviving ancient Egyptian surgical techniques, particularly in the field of neurosurgery, where their understanding of the brain and skulls seems to have been remarkably advanced. Some doctors are even advocating for the reintroduction of certain herbal treatments that fell out of use after the rise of synthetic pharmaceuticals, treatments that the AI has now confirmed were chemically sound. But here's the part that makes people uneasy. If the Egyptians had this level of knowledge 3,500 years ago, and we lost it, what's to stop us from losing it again? What's to stop future generations from looking back at our medical texts and thinking we were primitive, only to rediscover centuries later that we actually knew far more than they gave us credit for? History, it seems, doesn't move in a straight line. Knowledge isn't always cumulative. Sometimes it's cyclical. Sometimes it's forgotten. And sometimes it takes a machine to remind us of what we once knew. The question that won't go away. What the AI found in those ancient Egyptian texts isn't just a footnote in medical history. It's a challenge to the entire narrative of human progress. We've been taught to believe that we're standing at the pinnacle of knowledge, that every generation builds on the last, that the arc of history bends toward greater understanding. But what if that's not true? What if knowledge comes and goes? What if civilizations rise, learn, achieve, and then collapse, taking their discoveries with them? The Egyptians had something. Whether they developed it themselves over centuries of careful observation, or whether they inherited it from an even older source, we may never know. But the evidence is undeniable. They performed surgeries we thought were modern. They used medicines we thought were contemporary discoveries. They understood the human body in ways we're only now beginning to appreciate. And the most unsettling part, the AI has only translated a fraction of the texts. There are still thousands of fragments scattered across museums and private collections, untranslated, unread, waiting. What else is hidden in those scrolls? What other impossible knowledge is sitting in the dark, waiting for the right tool to bring it into the light? Some researchers believe we've only scratched the surface, that the medical texts are just the beginning, that if we turn AI loose on Egyptian mathematics, engineering, astronomy, we'll find the same thing. Advanced knowledge that shouldn't exist, encoded in symbols and scripts we've been misreading for centuries. Others think we should be careful. That there's a reason some knowledge was lost, That maybe the Egyptians knew things we're not ready to rediscover. That maybe some doors are better left closed. But it's too late for that now. The AI has already opened the door, and what it revealed isn't just advanced, it's impossible. A medical tradition so sophisticated, so precise, so eerily similar to our own that it forces us to ask a question no one wants to answer. Were the ancient Egyptians more advanced than we are now? Or did they simply remember what we forgot? And if we forgot it once, what's stopping us from forgetting it again? What do you think?